Yarling, everyone. My name is Shalina Huda. I'm the National Council Member for the Women's Activities Portfolio. The portfolio's mission statement is to support and empower women throughout their lives and to offer support to their families as they grow. So welcome to our third session in our series, Preparing for Parenthood. And we are delighted to have you all join us today, and we are joined by the Aga Khan Health Board in offering you this session. For those who have recently welcomed a new child into their families, congratulations. Any of you that have one on the way, good luck for what is to come. I'll now hand over to Mira, who is one of the board members from the Aga Khan Health Board. Thank you.
Welcome everyone, and thank you for joining our webinar today. Our speakers for this webinar are Farah Hussaini, who is a nurse by training. She's an early intervention prevention lead, and she's a Heart Start trainer for the Aga Khan Health Board. And she's undertaken first aid and pediatric instructor training. She's also a mum of 9 and 12-year-old boys. And she will be delivering the portion around baby first aid tips. And Dr. Farah Banji is a GP in practice, and she's the mum of a 2-year-old boy. And she will be delivering the section around signs of ill health in babies. Welcome to our speakers today. Baby first aid in particular is usually delivered face-to-face with a practical component where parents get the opportunity to actually practice the skills that they're learning. Unfortunately, at this time, this is not possible. And so that is why we're bringing this webinar to you today to provide you with some knowledge, guidance, demos, and videos which will provide you with some tips of what to do in an emergency situation. Farah will cover dealing with an unresponsive baby, dealing with a baby who's choking, dealing with burns. We'll talk about where to get more information. And then Farah will cover signs of ill health in babies. And today we're covering babies from birth to 1 year. I'll now hand over to Farah, who will start the webinar. Farah, I welcome you.
Thank you, Mira, and Yana to everyone. So today I will be talking about first aid tips for irresponsive baby, which can be breathing and not breathing, about choking, and about burns. Before we start talking about the first aid action plan, I'll be doing a demo on a baby doll here. So the baby doll is called Elmo, and we'll be also watching a short videos after each sections. As a first aider, we follow an action plan around Doctor's ABC, and the reason we follow Doctor's ABC is just help us to remember the steps we have to follow while doing giving first aid to a baby or a child or an adult. So the action plan, Dr. ABC, is where D stands for danger, R is to check response, S is to shout for help, A is for airway, B is for breathing, and C to maintain circulation and giving cardiopulmonary resuscitation. So I'm gonna be doing demo while we're gonna talk about how we go through all this Dr. ABC while giving a first aid. So here's Elmo, and it's Elmo's tea time now, and I've come to wake Elmo up. So Elmo, wake up, it's a tea time. I'm gonna check Elmo's response by tickling on the feet. While I'm tickling on the feet, I'm constantly talking to Elmo as well. Elmo, wake up, it's tea time. Elmo is not responding to me. So what I do after that is I follow the next step, which is shout for help. So I shout for help, but at no point I will leave Elmo on her own. I'm going to shout for help from wherever I am if a family member can hear. The next what I'm going to do is I'm going to make sure the airway is open. So I'm going to go to the A, which is airway, and I'm going to open the airway. What happens when a baby, child, or an adult become unconscious or unresponsive? The tongue falls back, which causes the obstruction in our airway. So that's the reason first thing we do is to open the airway so airway is clear. We open the airway by putting our hand on the forehead and with the other two fingers on the chin bone here and tilting the head up. And that's how we maintain the airway, or we open the airway. Once the airway of the baby is open, then the next thing we do is we check for the breathing. In breathing, we look for baby's chest falling and rising, and we feel the breath of the baby on our cheek. So while keeping the airway open, hands on the forehead, other hand on the chin bone, head tilted, and we look and listen and feel for the breathing. And we do this for 10 seconds. So while the airway is open, we're checking for the breathing, we're looking for the baby's chest going up and down, and we're trying to feel the breathing. Elmo is breathing. So now Elmo is breathing, but Elmo is still not responding. So what I do next is go on then recovery position. Yes. So the baby Elmo is breathing, I'm gonna put Elmo in the recovery position. All we have to do is we hold the baby like this, and we hold the baby on the side, and with head supported, we tilted the head back on the side. And the reason we keep the baby's head on the side is if the baby do get sick, it can come from the sick or any drainage can come out from the side, and it's not going back again in the stomach or lungs and causing more harm. So that's how we put the baby in the recovery position. Now, if I'm on my own and my phone is not with me, I'm going to carry Elmo with me in the other room where I'm going to find my phone and I'm going to call 999. But if the family member is around us, by this time they have already made the phone call to the medical to seek medical help and advice. Now we're going to look at a short video which talks about dealing with unresponsive baby but breathing.
Check breathing by tilting their head back. Look and feel for breaths. Hold the baby on their side with their head slightly tilted back and supported.
Yeah, hello, ambulance, please.
Call 999. Remember, hold the baby on their side with their head tilted back.
Thank you. Now, next we're going to look into is a baby which is not breathing. So the steps remain the same. We follow the doctor's ABC. So I've come in the room. I've come here to wake Elmo up. Elmo is not responding. I've checked the response by tickling the feet. Check the response by Elmo's tickling on the feet. Elmo is not responding. The next what I've done is open the airway with my head on the forehead, tilt fingers on the chin, and head tilted. I've looked for the breathing for 10 seconds. I'm looking, and I'm also feeling for the baby's breath as well. This I'm going to do it for 10 seconds. After this, Elmo is not breathing. I'm going to shout for help. While help is coming, I will start the process of cardiopulmonary resuscitation. What we do in babies is we give 5 rescue breaths to babies. So all the time we have to keep the head tilted to make sure the airway is open. Then we seal our mouth with the baby's mouth and nose. So we go nearby and we make sure it's sealed. So when we give those 5 rescue breaths, they are not coming out from anywhere and they're going inside baby's body. So we seal our mouth with baby's mouth and nose, and we give 5 rescue breaths. After giving 5 rescue breaths to babies, then we give 30 chest compressions. When we're giving the 30 chest compression, the compressions are given in the middle of the chest. Now, to if you're wondering what is the point where we call middle of the chest, that can be done easily. So from the nipple lines, between two nipple lines, the center point is the middle of the chest, and that's where the bone is, where we need to give the compressions. So in babies, with our 2 fingers, we place the fingers in the middle, in the center of the chest, and we push firmly in the middle of the chest with our 2 fingers. This is done for 30 times. Now the rhythm we need to go is, you just count in your head while you're doing is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We go up all the way up to 30. Count of 30. Now, when we are giving the chest thrust, we have to remember that we have to do it firmly and deeply up to 4 centimeters. Sometimes we do worry about bones breaking, but at that point, our priority is saving life. If the bones do break during the, period of giving chest compressions, bones can be repaired, can be mendable, so they will be fixed. But the important thing is to save baby's life. So you give 30 good chest compressions. While giving chest compression, it's also important to remember not to leave the baby skin at any point. So your hands should be in contact with baby. It shouldn't be going like 1, 2. So it's all the time, it's skin contact, and good 30 compressions. After completing 30 compressions, we give 2 rescue breaths. Again, making sure the airway is open, head tilted. We cover our mouth with baby's mouth and nose, and that's how we give the 2 rescue breaths. The cycle keeps going, 30 chest compression and 2 rescue breaths, till the baby start giving you response, which can be start giving response by movements, by crying, or by opening the eyes, or till the help arrives. Now, if you are on your own, also as on the slides you can see that till baby's head, and we check for the breathing for 10 seconds. Baby is not responding, we shout for help. We give 5 rescue breaths, tilt head back, seal our mouth with the baby's mouth and nose, and then give 5 breaths. 30 chest compressions, which we push firmly in the middle of the chest with 2 fingers, and then we give 2 rescue breaths. We continue the cycle till the help arrive or till the baby start responding. At no point we leave the baby on our own. So when we say shout for help, if a family member is around, they'll call for help to 999. If you're on your own, before calling for the help, you give the 5 rescue breaths, do the 30 chest compression and 2 rescue breaths, complete 1 cycle, and then you go and find your phone. But at all the time, you carry your baby around with you. You can continue giving chest compression while you're making a phone call. Today, these days, we all got smartphones. It can be put on the loudspeaker, and the conversation with the medical staff can happen through that. If you can give, if the baby is young baby, and if you feel comfortable, you can do the cycle of chest compression while holding the baby in your head. At any point you think you're not comfortable, then you can always put the baby on the flat surface and then do the rescue breath and compression. Some of you may have done adult first aid course where we start with 30 compression and 2 rescue breaths. But it's only in babies and children. We start with 5 rescue breaths to start with, and then we do our compression. And the reason is simple, because in babies and children, mostly it's the airway, the obstruction is in the airway, or it's the lungs which is causing the lead to not breathing. And in adults, it's mostly to do with the heart and cardiac arrest. So that's the reason we start with 5 rescue breaths and 30 compression, 2 rescue breath, and we continue the cycle. If 2 persons are around, it's good to take turns, and both 2 people can give good effective chest compressions and rescue breaths. So we're going to look at the short video, which shows you how to give CPR to the baby who's not breathing.
First aid for a baby who is unresponsive and not breathing.
Emily. Honey. Emily, come on, wake up. John!
Check breathing by tilting their head back. Look and feel for breaths.
What's wrong? What's wrong?
She's not breathing. Call an ambulance, quickly.
Call 999.
I'm not breathing.
Give 5 rescue breaths. Tilt their head back and seal your mouth over their mouth and nose. Blow 5 times into the baby.
Okay, please hurry.
Give 30 chest compressions. Push firmly in the middle of their chest with 2 fingers. Give 2 rescue breaths. Continue with 30 chest compressions and 2 rescue breaths until help arrives. Remember, give rescue breaths and chest compressions.
Thank you. Next, we're going to move on to choking. So choking in baby caused by food or small toys. These common signs of choking is loud cough, unable to breathe. Cyanosis means the lips turns blue, and unresponsive. If the baby, while choking, if the baby becomes unresponsive, then we're going to follow our doctor's ABC, where we check, where we open the airway, look for the breathing, and we do the compressions. But if the baby is responsive and responding well, then what we do is we lay the baby face down along along our thighs and between the. So if you could see, so that's the baby's head is down, and along a thigh we can relay the baby down. What we do is between the shoulder blades, this is the area, so between 2 shoulder blades, we give good 5 back blows with the heel of our palm. So with the heel of our palm, we give 5 back blows to the baby, like 1, 2, 3, 4, 5. And if the baby continues to choke, then we turn the baby around. We hold the baby again facing upwards, but in this position. And what we do is we perform chest thrust. And when we call chest thrust, is again the center point is the same, the center of the chest. And with our 2 fingers, we push it firmly, but a bit upwards, and we give 5 chest thrust upwards. If you could see like this. 1, 2, 3, 4, 5. We check if anything is coming out, we take it out, and if the baby still continues to choke, we continue to repeat the cycle 3 times, where we give 5 back blows on the middle, on the between the 2 shoulder blades, and 5 chest thrusts. If again, if you are on your own, then you do the cycle 3 times and then call for help. If there is someone around, just ask them to call for help immediately. And it's always best to get a check with doctors or GP, even after the cycle and the baby is able to, you are able to take the obstruction out. So as we said, whole baby face down along the thigh, hit firmly on the back, below between the shoulder blades 5 times. And if it doesn't work, then we turn the baby over and give 5 chest thrusts. 2 fingers middle of the chest and push 5 times. And then, as we said, if it doesn't work, we call for help. In children which are above 1 year old, and in adults, we do abdominal thrust. The people who have done the adult or children pediatric course, they would be aware of it. In babies up under 1 age, we do not give abdominal thrust, and the reason is because the baby's liver is still in the middle and it's not developed properly. So if we do give the maneuver of abdominal thrust, it would damage the baby's liver and cause more harm. So abdominal thrusts are not appropriate for the babies up to the age of 1. We're going to look at the short video about choking.
First aid for a baby who is choking.
Yeah, oh, it's a lot cooler in here, isn't it? Yes. Yes, it is.
There we go, baby.
Yeah.
Emily? Emily? Open wide. Let me check. Okay. All right, Daddy knows what to do. Give up to 5 back blows. Hit them firmly between the shoulder blades. Give up to 5 chest thrusts. Push sharply downwards. If the object does not dislodge, call 999. Remember, give back blows and chest thrusts.
All right, thank you. The last, we're going to look at burns. The causes of burns common is hot drinks, touching pots and pans, bath water temperature, hair straightener, radiators, and heated towel rails. And I think it's very common when the baby starts crawling, or even when the babies, when you're holding the baby with the movements of their hands, if you're having the hot drinks while holding the baby, the burns can happen. So the simple treatment for burns are so cool the burn under cold running water for at least 10 minutes. If it's a significant burn, then we cover with cling film or a clean plastic bag. And yes, definitely we call 999 and seek for urgent medical advice. What we do not ever do is we do not burst any blisters. We do not put any creams, lotion, oils, or sprays. And also we do not use cotton wool or any plasters to wrap the burn or cover the burn. Thank you so much, and I'm going to pass it back to Mira for further information.
Thank you, Faranaz. So at this time where we will not be able to go on a practical first aid course, we'd like to highlight some areas where you can get more information, and we can provide these to you afterwards. So both St. John's Ambulance and British Red Cross have a lot of good information about baby first aid on their websites. And the British Red Cross have an app that you can download, keep on your phone, and you can get the advice quickly. For those of you who are involved with NCT, once physical courses are able to happen again, many NCT groups run baby first aid, as do St. John's Ambulance and British Red Cross. And the NHS does recommend that parents, where possible, do try and take a baby first aid and a child first aid course so that they're prepared and what to do in an emergency. Children's centres as well, when things get up and running again, often run face-to-face baby first aid courses. And then the Aga Khan Health Board runs a 1.5-day, 12-hour paediatric first aid course, which also covers baby and child first aid. I'd now like to hand you over to Dr. Farah Banji, who will talk about signs of ill health in babies.
Thank you, Mira. Yali Madat, everyone. I would like to spend some time really concentrating on the signs and symptoms of an unwell child, so that you're able to be aware of when to access medical help and when it is completely appropriate to offer self-care. Before I begin, I just want to point out that as parents, you know your baby the best, so don't forget that, and really trust your own instincts. If you feel that your baby is unwell for whatever reason, even if you don't know why, do seek medical help. And I think this holds particularly true during this time. We are currently living in extraordinary times during the COVID pandemic. But just to remind you all that both community and hospital services are open for children, and we would expect parents to access help as appropriate. We know that face-to-face contact is being prioritised, but certainly the help is there if you need it. So what are the potentially serious signs of an unwell baby where the recommendation would be to call 999 and to go to A&E? We call these red signs. Don't worry with the signs that I'm going to cover if you don't catch them all, because all of this information will be included in a handout which will be given to you after the workshop. So what are red signs? So red signs can include signs in a baby when they're unwell about their skin colour. So the baby could be unwell, but actually has an abnormal colour in their skin. So they could look particularly pale, have really blotchy, mottled skin. They may feel hot, but actually have abnormally cold hands and feet. Or they may have a pinprick red purpley rash which doesn't fade when you press on it, and I'll be covering the rash later on. But these are typical of red signs where we would expect you to dial 999 and go to A&E. I think other signs, particularly in young babies, and by that I mean under 8 weeks of age, can be a little bit more vague. So I think in young babies, if you are extremely concerned, particularly if the baby has a temperature above 38 degrees, then that is enough reason, again, to access emergency care. Obviously, if your baby has a fit or a seizure, you need to dial 999, even if the baby has then recovered. If your baby is really extremely agitated, and this may manifest as the baby having an abnormal cry, so not like their usual cry, it may be quite high-pitched in nature. It might be that they are really truly inconsolable. You've tried lots of distraction measures and comforting techniques, and they continue to have this abnormal cry. And then really what Faranaz has already covered in her talk, if the baby stops breathing, if you're unable to wake them, if they're choking, then these are all reasons to call 999 and go to A&E. And then we have the amber signs. So really amber signs are signs in a child where we would expect you to contact your GP, and if they're closed, to speak to NHS 111. And that would be really same-day advice that we would be recommending. And really those signs, they could include if a baby is struggling to breathe in any way. So they may be breathing more rapidly, they may be using extra muscles to breathe, so they might be sucking in their tummy as they're trying to get a breath in. They might be having sort of noisy breathing. And the breathing difficulties might be affecting their feeding. Also, if you think your child is dehydrated in any way, and this might manifest in the baby not producing as wet nappies as normal. They may be crying but without any tears. The baby may have sunken eyes, or their soft spot in young babies may have sunken down, and they could have a dry mouth. So again, a reason to access medical advice that day from your doctor. If your baby is excessively sleepy or more irritable than usual. And this is where I mean that as parents, you know your baby the best. Babies have different crying patterns and routine, but if the sleepiness, the crying is different to what you expect your baby or how you expect your baby to behave, then do access medical help. And then in slightly older babies, so from 3 to 6 months, if they have a temperature of above 38 degrees, then that's another reason to speak to your GP that day. And really in any child, even if it's been a mild fever, if the fever has continued for 5 days or more, another reason to contact your GP. And really, amber signs can include any reason for you to feel worried about your child. So if there's any particular reason that you're worried about your baby, then do speak with your GP. And then we have green signs. So this is really where self-care is quite appropriate, and for you to manage caring for your child at home and to monitor the situation. And actually, green signs are really when none of the amber or red signs are there and you're not worried. So, for instance, it could be that your baby is unwell. They may have a runny nose and a mild temperature, a high temperature, which comes and goes, but the baby's feeding well and you're not concerned. And therefore, it is quite appropriate to monitor your baby at home and manage them accordingly. And with regards to fever management at home, the advice is now not to use sponge baths or to place your baby in tepid water. And actually, you can remove clothes, but you don't need to undress them completely and certainly not to overdress them. So it's to keep them comfortable. You can give medicines, but really this is not to treat the fever. It's really if the baby is distressed or uncomfortable because of the fever, then medicines may help. And that includes both paracetamol and ibuprofen. But the advice is not to give the two medicines together. So you could start with one, and if after 2 to 3 hours your baby is still uncomfortable and distressed, then you could try the other. But just remember, paracetamol is to be given to babies over the age of 8 weeks. And with ibuprofen, it's over 6 months. Although younger babies can be given ibuprofen, but that's really on a doctor's advice. There is an exception to this. So this is when your baby is undergoing immunizations. So there are some vaccinations where fever in the child is really common, and you will be guided about giving regular paracetamol doses. And it's usually up to 3 doses regularly to prevent or control a fever reaction post an immunization. So this is where it's slightly different about the advice on giving paracetamol. So those are the signs, and I've generally sort of spoken about, as I say, the broad signs of an unwell child. I do want to mention 2 specific conditions, and that's sepsis and meningitis. They are rare, but because they are serious and potentially life-threatening, I would like to just spend a few moments on them. So just to inform everyone, meningitis is inflammation of the meninges, which is the covering of the brain and spinal cord. And this becomes inflamed due to several different germs. Septicemia is when blood poisoning occurs because of these germs. Now, there are vaccines which are included in your baby immunization screening program that do offer really good protection against both of these conditions, but they can't protect against all forms of meningitis and septicemia. And that's why it's important for parents to be aware of the signs of these conditions. And actually, we've covered the signs of meningitis and septicemia because they're included in the red and amber signs. But the difference really, compared to other childhood conditions which can cause amber and red signs, is with meningitis and septicemia, the baby becomes unwell very, very quickly. So if you notice this quick progression, they may have started with some amber signs like irritability, and they're progressing and becoming excessively sleepy, more irritable, then take that seriously. If you see that very quick progression, and dial 999, it's quite appropriate to do that, particularly in young babies. And actually even more so important for young babies, and as I say, that's really less than 8 weeks old, because with these conditions, they don't always manifest all the signs. For instance, with fever in young babies who may have meningitis, they may actually show a low temperature. So that's why, as I mentioned earlier, if you are extremely concerned about your young baby and they're less than 8 weeks old, then do access emergency care. So just to recap on the signs or potential signs of sepsis and meningitis, that can include a high temperature, but as I've mentioned, in very young babies, it could be a low temperature, an abnormal color, so they could be unwell, be very pale or mottled, have abnormally cold hands and feet. And as the picture on the slide shows, a rash which doesn't fade if you press against it. And a good test for this is using a glass tumbler as shown on the picture. You need to apply quite firm pressure, but you can look through the glass and see if the rash is fading or not on applying firm pressure. If your baby has breathing difficulties or is excessively sleepy, or as I've mentioned, is becoming increasingly irritable, perhaps manifesting in a high-pitched cry. A more specific sign of potential meningitis in a young baby is if their soft spot begins to feel tense or is bulging in any way. Take that seriously. So I've given just a very brief overview of serious illnesses and the signs that you need to look out for. And obviously there are many other illnesses and conditions that can affect babies, such as eczema, reflux, earaches and colic, and I'm sorry that I can't cover those particular conditions in this workshop, because really the discussions are more case-based. But it is quite appropriate for you as parents to contact your health visitor as a first port of call and your GP and discuss these conditions with them, even at this time whilst we're going through the pandemic. The Aga Khan Health Board, they also have an advisory service, and I know details will be given later on with how to contact them. So again, if there's any particular conditions you would like information about, do use that service. If it's more general information, nhs.uk has very useful information about these conditions on their website. And I know that later on in this workshop, you will be given further information about support agencies for parents, particularly first-time parents. But I would like to just draw your attention to a newly launched website. And this is, it's been in response to the restrictions that have been imposed because of the COVID pandemic. And the website is iconcope.org. And it's really relevant for first-time parents of newborn babies, and it's got information about coping techniques, particularly for dads, actually. And I sometimes feel dads are slightly neglected during this time. So do have a look at the website if you think it will be relevant to you. So thank you for listening. Just remember, do trust your instincts. You know your baby the best. And enjoy the great journey of parenthood. Thank you.
Thank you, Farah. We have been asked a number of questions via the questionnaire that you filled in. And the first question that I'd like to ask Farah to respond to is how to know more about my baby's health and how to know whether my baby is doing well.
Thanks, Mira. Yes, it's a good question. I think the first port of call is still the health visitor. So, and parents will know this, particularly if you've had their babies. But just to inform everyone, when your baby is born, you're under the care of a midwife and discharged at around sort of 10 to 14 days. And then you're assigned a health visitor, and it will be a named health visitor, and you will have their direct contact details. So actually, if you do want to know more about your baby's health, they're certainly the first port of call. And a health visitor is able to guide you, is able to signpost you so that you can monitor your baby's health. You are also given a personal child's health record book, what we call the Red Book. And actually, if you look in that, there's also a lot of information and tips about monitoring your baby's health. So, for instance, it will give some guidance as to when you should expect your baby to start smiling, to be babbling, ways that you can tell if your baby is hearing properly, if they're seeing well. So there's a lot of information in your Red Book. But I would say for more specific questions, do contact your health visitor.
Thank you, Farah. I now have some questions for Farah Naz. Before we go to the ones on screen, we've had a question. How does one know if the child is choking? Are there any telltale signs that we could look out for?
So if the baby or child is choking, as they'll cry, they'll get in distress, and they're going to start coughing as well. It's going to become hard for them to breathe. The color of their, as we said, they will change blue around the lips. There will be difficulty in breathing and coughing. Either they'll cough a lot, or they'll get unresponsive. So these are the signs which will, it's very clear, because as soon as you start choking, you find it hard to breathe. And the first response, natural response, is try to cough it out. And that's what they're going to try to do. But in babies, it's mostly going to go, color is going to change, and it's going to be distress in breathing.
Thank you. And then the next one is, what is the first aid if a child drinks liquid soap or disinfectant liquid?
So according to the pediatric first aid, if the child has drank liquid soap or any disinfectant, we can try rinsing away the chemical, or could do brush teeth if it's possible. If the babies are older than 6 months of age, then, and if they have drank some corrosive chemical kind, then cold sips of water can help, taking them in the fresh air. But in the end of, but above all, it's seek medical advice straight away, and report to the medical staff as well, that what kind of liquid or disinfectant they have drank, or any chemicals, providing them the full knowledge of that as well.
Thank you. And treating bumps or falls?
Okay, so the bumps can be treated by putting applying something cold, which can be frozen vegetable wrapped in a tea towel. It's just applying something cold helps reduction in swelling, and it helps reduce in pain as well. With falls, it again, it depends on just to keep an eye on them, make them comfortable. If there's swelling around if it's just the bumps, then we can put cold compress. But if it's swelling around the areas, again, limbs, or then if swelling occurs, then we take them to the, take them to the emergency and seek medical advice. But in babies, any kind of falls, seeking medical advice is appropriate.
Thank you. And then the last question we received is about child CPR.
Okay, so when we say child CPR, the age is between from 1 year old up to puberty, which you can say up to 12 year of the age, 11 to 12 year of the age. In children, we say in babies where we use 2 fingers, in child we use 1 hand, and if the child build is a bigger build, then you can use 2 hands as well. So the position remains the same. The process remains the same. We start with 5 rescue breaths and we do 30 chest compression. But instead of doing the 2 fingers, we use 1 hand and press the chest down 30 times and then give 2 rescue breaths. Or we can use 2 hands by locking with 1 hand each other, and again at the center of the chest we perform the 30 chest compressions and 2 rescue breaths. So we start with 5 rescue breaths, 30 chest compression, and then 2 rescue breaths, and carry on the cycle.
Thank you very much. Thank you very much. I'm going to hand over to Firoza now for the last few slides.
Thank you, Mira. And thank you so much to all of you for joining us today. There's been a lot of really helpful information conveyed, so we'll make sure that we do circulate a summary of the key information after this session. So just very quickly before we close today, we wanted to take a moment to highlight the additional ways in which we can support you. So firstly, the coronavirus support team, which is on hand for any support that you might need during this time. Not just physical or logistical support, but also emotional support if you need it. The contact details are listed here, and they're also available on the Ismaili website and in Al-Sahar. Many of you may also have heard of the Sisterhood, which is a new initiative launched by the Women's Activities Portfolio, bringing women together to discuss different topics such as loneliness and relationships, and discussing tools and techniques that we can use to support ourselves and our families. Our next session will be next Sunday, the 14th of June, so please look out for marketing and registration details next week. Of course, the Aga Khan Health Board is always on hand to support with health-related issues, and I'd also like to take this opportunity to thank AKHB for their collaboration with us on today's session. Our next Preparing for Parenthood will be held on Sunday, the 5th of July. We'll be covering faith formation, which starts in the womb, and we'll also be talking about creating a routine around practicing faith at home, in the current climate and beyond. We'll also help to provide a greater understanding of the significance of bay'ah. Finally, I'd like to take a moment to highlight the Embrace programme, which provides one-to-one support for parents of newborns. This support really can be anything that's helpful to you as new parents, be it health-related, day-to-day guidance, or also if you just want someone to talk to. So please reach out to AKHB to find out more about this programme. Thank you once again for joining us today, and we look forward to connecting with you all again soon. Thank you, and Yali Madat.